This is a recording of Dr. Tom Roselle Live for Sunday, January 2nd, 2011. You can listen to Dr. Tom Roselle Live every Sunday from noon to 1 p.m. right here on 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, and I am live in studio today on kind of this transition day, if you will, into 2011. We're here this Sunday and every Sunday at 12 noon trying to bring you the most up-to-date and informative and absolutely applicable information to change your health, to change where you are right now, because your health truly is a do-it-yourself program, and we're going to talk about how to set goals today. You've tried and you've applied and you've come up with things that don't work. Well, let's do something that does work. Let's change. Let's use 2011 as the pivotal point to make a difference in your life. What do you think? Let's put it together. Let's turn on, our thinking caps, and let's see what we can do. Let's talk about all the maladies that you have, what steps you need to take, and let's go from there. The number here is 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Let's see if we can take that and let's make a difference for you. Let's turn it around. Let's actually do something positive this year instead of the same old, and wringing my hands and what do I expect from my age and so forth. Well, you know what? You know what I expect from me? I expect 2011 to be my greatest year ever on many levels. And I've already sat down, I've got my goal book out, and I'm starting the process. And I've already listed them. I know what I'm going to do this year. I know where I want my health to be. I know where I want my professional life to be. I know where I want my financial life to be. But guess what? What we're talking about is your health goals for 2011. Because you know what? If you don't have that, if that isn't your first number one value above everything else, you've got nothing. You have absolutely nothing. You can have all the money in the world. You can have all the prestige that you want. But if you don't have your health, if you don't have the capacity, the energy, the ability, the application of your own physiology, then you have nothing. So let's do something about it. Let's give you something. Let's take the process. If you've gone through our website at rosellecare.com, you've been directed this whole week to a list of 6 steps to change your life, to change your health. And we're going to talk about those, but we're going to talk about them specifically. We're going to talk about them as it applies to different types of conditions and what you have to do. I think you're going to be surprised how that comes about. I think you're going to be very surprised that it's very simple. Patients come in, and over 35 years of practice, they've had many different challenges in their life. They've had the challenge of low back pain and migraine headaches and irritable bowel problems and allergy reactions and, unfortunately for some people, cancers and heart disease and so forth. And in so many different cases, people are kind of stuck. What I mean by that is they've been told that it is what it is and that's all they can do about it, and they have to take these drugs for the rest of their life, and then ultimately they're going to be debilitated. They have to restrict what they do, and the sadness is that they buy into that. Well, let me give you a heads up. You don't have to live with anything. There's a decision. The body is extremely forgiving. As long as you're breathing, as long as you're sitting here listening to me, you have a capacity. You can be far better than what you are right now. I totally believe that. I've believed that for more than 35 years. And I've tried to lead my professional life that way, trying to help as many people as I possibly can to achieve their health goals. And what I want to do today is to help you achieve your health goals in 2011, because you can. There's no reason for you to stay where you are. But the number one thing that you have to do beyond everything else, we're going to talk about the 6 steps. And the first one, before anything else, you have to decide. You have to decide. If you go into my book, Ageless Health 101, Health is a Do-It-Yourself Program, you're going to find these all laid out, but I want to go through and I want to apply them to different conditions. But your failure, anybody's failure, to do anything is the inability to totally commit. The decision to do something about your health. The decision to take action. To put off anything else. See, the word decide means to cut off from. It means there is no other option. There's only one direction. You must decide. And if you've truly made a decision in your life to change in this situation in your health, well, there is no someday I'll. There's New Year's is coming. Well, it just passed, so you got to do it now. And we can come up with everything, stress and life and my kids and my job, and you just don't understand, and I don't have the time, and, oh my God, I have to give up what? I have to change what? Well, see, what we want to do is we want to design something that we can move towards in changing the stage of the problems that you have. We want something different. We want to develop a platform, if you will, that will allow you to build from this moment forward and incrementally looking forward to something. So here's what I tell my patients to do. Once you decide, and truly decide, that means emotionally committed in every sense of the word, your being, your mind, your heart, you're there. You said, enough is enough. You've had enough. You've had enough. No more. I have to do something very differently. Once you've decided and you own that decision, because life is be do have. Remember, we're going to talk a little bit about that as we go through today. Be means that you're there. That is who you are. You're no longer that other person. See, what you have to do is take a yellow legal pad. Forget the computer. I want you to do it with an old-fashioned pencil or pen and a legal pad. And I want you to sit down, and I want you to describe the outcome. I want you to look forward. What it is that you truly want for your health. What do you want? What does it look like? What does it smell like? You want to have, it's not like I want to quit smoking, I want to lose 35 pounds, I want to, whatever that is. See, those are negative pieces. You want to have positive strokes. I want to be able to breathe better. I want to be able to weigh 100 and whatever that weight is, not losing the weight, but you want to go towards something. I want to be able to walk 15 miles. I want to do the Walk for the Cure next year, and you're going to do 20 miles a day for 3 days in a row. You need to move towards a vision. For many of you, all you got to do is go back and take a picture of when you were much younger, put it up on the board, and take a picture of you now. Yeah, if you really want to get startled, have your spouse or whoever you're with take a picture of you in your underwear. Okay, strip down to nothing. And take that picture and compare it to what you were years ago and say, okay, where do I want to go? So the pain is the one that you have now, and maybe the vision of where you want to move towards is the one that you had years ago. So here's what we're going to do. We're going to decide. We're going to decide that it's time to move forward. We have to change our attitude, but to do that, we have to create this canvas of what it's going to look like. I want to have a blood pressure of 118/68. I want to have a cholesterol level of 184 or 198. I want to have a blood sugar of 85. I want to have whatever. You list the exact thing that you want to achieve. See, your brain will move towards things that it sees. Whatever it focuses on is where you're going to go. So if you want to focus on smoking, all you got to do is say, I want to quit smoking, because that's going to be in your brain. What are you thinking about? Smoking. I want to quit smoking. I quit smoking. I'm not a smoker anymore. You're constantly talking about smoking. Sounds silly, but it's absolutely true. I'm going to take this weight off. I can't do that. I'm too fat. I want, it's how do you want to be? I want to be whatever that is. Create it exactly, specifically, with every sensory input that you can possibly surround it with. That's the way you do things. You want to move towards. You don't want to move backwards. You don't want to look over your shoulder. So let's do that. Sit down, write it down. Make it very clear. Decide what it is that you want to look like, feel like, be like, energy, and all the pieces that go along with that. And do it as specifically, do it as clearly as you possibly can do that. If you're smoking a pack of cigarettes a day, or if you eat sugar ongoingly, there's something in there all the time. If you have the inability to exercise, we have to be able to put those things in. So there's things that you must change, and you need to list those. So I want you to write down those things that you must change, and then put down the positive piece of that change. Okay, I need to quit smoking. I need to lose 25 pounds. And then the next column is, I can breathe better. I want to be able to do this better. I want to weigh whatever it is. And that's the step. You need to take action. So let's talk about somebody who, for example, has high blood pressure, and you're on all kinds of medications. And, the list is about 5 or 6 or 7, or in some cases even more than that, of the different types of meds, because you're given one to offset the other. Do you say, I want to get off all these medications? Well, that's a start, yes. But why do you want to get off the medications? Why do you want to change? And it's not because it's going to make me healthy, because healthy is nebulous. Your body doesn't know what that means, neither does your brain. What is healthy? Healthy is, I want to have a blood pressure of. Okay, so let's write that down. I want to have a pulse rate of. I want to have whatever those markers are, put it into a positive place. Now, next step, all right? We've already decided that we have to write all these things down. We've decided, and that we're going to move forward to the next thing. We have to take some action. Dear friend of mine, Tony Robbins, who I've known for many, many years, says that you never leave the site of any kind of decision without taking action towards that decision. Let me tell you again, you never make a decision on anything unless you're willing to take a step towards that process and that outcome. So how do we do that? Well, if you decide that you want to give up the blood pressure medication, and because you want a blood pressure of 118/68, what's the next thing that you need to do? Well, how about getting a person that will hold you responsible, an accountability partner? Might be your spouse, might be somebody that you really have a lot of respect for, and you never want them to think badly of you. That's a good one, by the way, because you'll be embarrassed if you don't do the things that you said you're going to do. So I would list a couple, actually. I would get a couple different people that you know deep down inside will hold you responsible for your decision, and they're not going to let you off the hook no matter what. No matter what. It can be your friends on Facebook. Just publish it, put it out there, and just, tell them, this is what I want you to do. I'm going to tell you what I'm going to do every time. Or maybe it's your friend Peter, it's your friend Janet. Tell them what you're doing, and tell them that you want them to be involved in the process, and you want them to hold you accountable. All right, now you have to take action on this, and you have to decide to do something that you've been putting off for a long time. Maybe it's just going out for a walk. Maybe for the first time, and you can only walk maybe 3 minutes away from your doorstep and 3 minutes back from your doorstep or to your doorstep. That's 6 minutes, okay? So we're going to set up a program. We're going to walk away 3 minutes. We're going to come back 3 minutes. Tomorrow we're going to do 3.5 minutes, and then we're going to do 3.5 minutes back. And then you're going to build up very, very slowly. I'm not going to try to make you Olympians. I'm going to try to give you a game plan to change. Maybe it's cigarettes that's keeping that blood pressure up. Maybe you're going to decide today is the last day I ever will smoke anything, and I'm going to breathe. I want to be able to inhale. Most of you smoke cigarettes because you want to bring that into your body and expand your chest. Well, why don't you do what I did 38 years ago? I took them out of my pocket, I threw them out the window, and I was done. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, and I am here live at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're talking about goals, your healthcare goals, your problem situations that you want to get rid of and make life very differently for you. This is 2011. My goal is to make the best ever, and I have set standards for myself that I'm going to move towards. I've recreated my picture. I've sat there for the last 2-3 days, and I am very specifically coming up with those things that I want to become or enhance in my life. There's two terms.